Alrighty, hello again. Welcome to this Friday edition of the Town Meeting Program. A brief one, but an important one. Friday, July 10th, here on KLAM. Sponsored as always by Cordova Wireless Communications, which is your local provider of cell phone and wireless data services, and your local provider of the talk show that we call Town Meeting. Available on demand, by the way. We don't just necessarily sit here and do this every day because there's nothing better to do, but if there's a need, we are glad to do it. And wanted to reinforce a couple of things that came up yesterday. Incidentally, if you didn't have an opportunity to hear the daily briefing yesterday, it was a good one because we not only had our own Dr. Sanders, but also Dr. Ann Zink, the Chief Medical Officer for the state, and really the leading medical voice for all of Alaska's COVID response. She was able to take some time to visit with us, and I'm actually hoping to have another visit with her, a little bit more extended one, sometime here in the near future. We're just trying to get our schedules to coincide, but if things go well, we should have another program with her to bring you soon. But the two doctors together, I joked yesterday, it was kind of like if you want to learn about the moon, have a conversation with Neil Armstrong and Buzz Aldrin. You know, if you want to talk about COVID response, you talk to Dr. Zink and Dr. Sanders. So that show is the daily briefing for the 9th yesterday, and you can listen to that at your leisure and share it with others at youtube.com/CordovaTV. Now, to supplement that, we wanted to just quickly share this latest news release that came from the city, because obviously this has been a tough week for us in terms of the presence of the virus making itself known. So this is a community health advisory that came out directly from the city manager under the headline, "Individuals urged to practice all health precautions to avoid spread of COVID-19. The City of Cordova urges all individuals in the community to be extremely cautious and implement all recommended health precautions following the recent increase in the number of COVID-19 cases in our community. City leaders acknowledge the increase in positive COVID-19 cases raises a concern about further community spread. As a precaution, residents and visitors are strongly encouraged to heighten their compliance with the following recommended health precautions. Number 1, maintain a 6-foot distance from others, even when wearing a mask. Number 2, shrink your social bubble by limiting interactions with those outside of your immediate family or friend group. Number 3, wear a mask that covers your mouth and nose when in public or around others outside of the immediate family where social distancing is not possible. Wearing a mask in public is mandated by the city. Number 4, wash hands often for at least 20 seconds. And then number 5, sanitize often touched surfaces. City Manager Helen Howarth said, because the virus can be spread unknowingly by asymptomatic individuals, we each have to step up our precautions. We owe it to our family, friends, and neighbors. Through our individual action, we have the power to control the spread of COVID-19 in our community. And that last point is worth reinforcing. Again, this is a community health advisory that came out last evening from the city manager. Through individual action, we have the power to control the spread of COVID-19 in our community. Dr. Zink described that yesterday as, the reality is that if, and she didn't suggest that we do that. She offered it as a perspective that if everybody in a community, once COVID showed up, if everybody in that community isolated themselves for 2 weeks, the virus would die and go away. Now, obviously, that's not practical. There are reasons that people need to move around. But again, just for the perspective, if that happened, there would be no spread of the virus, and the ability to spread the virus would go away because it doesn't last in a person for more than 2 weeks in terms of being contagious. So the point that she was making, and that the medical professionals at all levels have made, is that each individual person, each family, has virtually unchecked power to make sure that you don't catch it or the people in your family don't catch it by being very diligent with these recommended precautions. Social distancing, limiting interactions, wearing the mask, washing hands, sanitizing surfaces. You can virtually guarantee that you or your family members will not catch this if you do all of these things. It's virtually impossible if you follow all these guidelines to catch it. And if you can't catch it, you can't spread it, obviously. So while we can't all control each other, and in the interest of civil society should not be, going to the extremes that we've seen. And both Dr. Sanders and Dr. Zink mentioned this again yesterday, that hostility towards your fellow community members has no place in a good response. People need to be nice to each other. Don't mask shame people either way. Don't pick on somebody if they're wearing a mask and call them un-American or socialists or wimps or whatever stupid things people say when they do that. And on the flip side, if somebody's not wearing a mask, don't, threaten to beat them. And I mean, people are doing this in the lower 48. They're shooting each other over this. They're going on crazy rants in stores and getting in fights, punching each other out, throwing each other around. I mean, it's just nuts. And I haven't heard about that level of escalation happening here. But, you can look at somebody not wearing a mask and think in your head, well, that's a jerk thing to do or whatever. Remembering, of course, that sometimes people are not wearing masks because they can't, because they have respiratory issues or diagnosed claustrophobia issues or whatever. But even if somebody is out there not wearing a mask, they're not a threat to you if you stay away from them. That's just the science. It'd be nice if everybody would wear them. They are mandated to be worn unless you have a medical reason. But if you are particularly concerned, especially if you're in a vulnerable group or have to be in contact with somebody who's in the vulnerable group, the elderly, the immunocompromised, it really is very, very possible when we're in a situation where there would appear to be community spread to simply make the choice to protect yourself and your family by isolating yourself voluntarily, not waiting for some kind of a government mandate, not worrying about whether other people are doing it or not, but yourself, you can protect yourself. You can urge your friends who are not in your bubble to also do that. Obviously can't control them, but certainly urge them to do these things. Because if you don't go into grocery stores, if you take curbside delivery, if you invite the volunteers who are helping people to check mail and do some of these other things, if you wear your mask, if you maintain your distance and so forth, the chances of you catching it are extremely minimal. So I really like, again, if you listen to yesterday's daily briefing with Dr. Zink, and again, this statement by the city manager, through our individual action, we have the power to control the spread of COVID-19 in our community. There again, the power, the vast majority of the power lies with us. And I personally derive a great deal of comfort from that. I worry about friends who are not careful, obviously. I always try to encourage them to be safe, but ultimately can't control what other people do. But Leslie and I and Robbie, we all know that we can control what we do, and so that's what we focus on first and foremost, and then do everything we can to help others beyond that. So I don't know if that brings anybody any. I mean, we've been hearing this a lot. I hope that brings some courage to folks, or comfort, or whatever, to realize how much power you have to impact your own situation and those close to you. And on behalf of civil society, I'm sorry that there are jerks who don't seem to know how to handle this situation and feel that being rude or hostile to others is their only outlet. I don't understand that, because it's not in my DNA to be that way. But I would, to those of us more in the center, I would encourage you, like we do, to recognize those people as outliers. And don't let them get under your skin. If you get approached by one, just, realize their behavior says more about them than it does about you. So with that, we'll bring it to a close. If you want to look at this news release, it's the one dated July 9th, the Community Health Advisory from the city manager. If you want to hear the daily briefing that featured Drs. Sanders and Zink, that's on our YouTube channel, youtube.com/Cordova TV, where this show will also go if you want to share it with somebody or listen to it again later. We'll have our daily briefing later today, the current one that will be coming up this afternoon in the 1, 5, and 8 p.m. hours. I'm hoping again to have another visit with Dr. Zink pretty soon to be able to ask her some more Cordova-specific questions. We'll see if we can make that work. And again, we want to offer a big thanks to Cordova Wireless Communications for sponsoring this program, the Town Meeting Talk Show, here on KLAM. Glad to have had you listening. Hope you have a great weekend. Follow those guidelines, and you should be pretty safe.